Question 1. The assessment process reveals that a dance/movement therapist has reviewed a recently published peer-reviewed study suggesting a specific movement protocol significantly reduces anxiety symptoms in adults with generalized anxiety disorder. The therapist is considering how to best incorporate this finding into their practice with a new client who presents with similar symptoms. Which of the following represents the most ethically and professionally sound approach to utilizing this research? Option A. Disregard the study's findings, as most research in dance/movement therapy is preliminary and may not be directly applicable to individual clinical practice. Option B. Immediately implement the suggested movement protocol with the client, assuming that the study's positive findings will directly translate to improved outcomes for this individual. Option C. Modify the movement protocol based on personal intuition and anecdotal experience, without a thorough review of the study's limitations or its relevance to the client's specific needs. Option D. Carefully evaluate the study's methodology, sample characteristics, and statistical rigor, and consider how its findings align with the client's individual presentation, treatment goals, and other evidence-based interventions before deciding whether and how to adapt the protocol. The correct answer is D. Carefully evaluate the study's methodology, sample characteristics, and statistical rigor, and consider how its findings align with the client's individual presentation, treatment goals, and other evidence-based interventions before deciding whether and how to adapt the protocol. Explanation. The assessment process reveals a common challenge in dance/movement therapy practice: the integration of research findings into clinical decision-making. Professionals are ethically and professionally obligated to base their interventions on evidence-based practices, but interpreting and applying research can be complex. This scenario is challenging because it requires the therapist to move beyond simply reading a study to critically evaluating its methodology, relevance, and generalizability to their specific client population and clinical context. The therapist must also consider the limitations of the research and avoid overgeneralizing findings. The correct approach represents best professional practice because it demonstrates a commitment to evidence-based practice, a core tenet of ethical dance/movement therapy. This approach involves a thorough and critical evaluation of the research, considering its strengths and weaknesses, and then thoughtfully integrating it into the clinical decision-making process. This ensures that interventions are not only theoretically sound, but also appropriate and effective for the individual client, aligning with the ethical guidelines of the board's Certified Dance/Movement Therapist, BCDMT, which emphasize competence and client well-being. An incorrect approach that involves uncritically accepting the findings of a single study and immediately implementing its recommendations without considering the study's limitations or the client's unique needs represents a failure to exercise professional judgment. This can lead to ineffective or even harmful interventions. Ethically, this demonstrates a lack of due diligence and a potential violation of the principle of providing competent care. Another incorrect approach, which dismisses the research entirely due to minor methodological flaws, fails to acknowledge the value of emerging evidence and may lead to the therapist operating outside of current best practices, potentially hindering client progress and failing to uphold the standard of care expected of a BCDMT. Professionals should approach research integration by first identifying relevant research that aligns with their clinical questions. They should then critically appraise the methodology, sample size, statistical analysis, and conclusions of the study. This critical appraisal should be followed by a consideration of how the findings apply to their specific client population, considering individual differences, cultural factors, and the clinical setting. Finally, the therapist should integrate the research findings with their own clinical expertise and the client's preferences and goals to inform intervention planning. This iterative process ensures that practice is informed by evidence while remaining client-centered and ethically sound. Question 2. Implementation of music and rhythm in dance/movement therapy requires careful consideration of its impact on the client. A BCDMT is working with a client who has a history of trauma and exhibits significant anxiety. Which approach best reflects the integration of music and rhythm in this therapeutic context? Option A. Select music with a moderate tempo and predictable rhythm that has been shown to promote relaxation and grounding, while continuously observing the client's physiological and emotional responses and adjusting the music as needed. Option B. Utilize the client's preferred popular music genres, regardless of their tempo or lyrical content, to foster a sense of familiarity and engagement. Option C. Employ loud, high-energy music with a fast tempo to stimulate the client and promote a sense of catharsis. Option D. Introduce highly complex and improvisational music with unpredictable rhythmic patterns to encourage spontaneous expression and challenge the client's comfort zone. The correct answer is A. Select music with a moderate tempo and predictable rhythm that has been shown to promote relaxation and grounding, while continuously observing the client's physiological and emotional responses and adjusting the music as needed. Explanation. This scenario presents a professional challenge due to the nuanced application of music and rhythm in dance/movement therapy, requiring a therapist to balance client-centered needs with established therapeutic principles and ethical considerations. The therapist must assess the potential impact of specific musical choices on a client's emotional state, cognitive processing, and physical responses, ensuring that the integration of music and rhythm serves the therapeutic goals rather than becoming a distraction or causing distress. Careful judgment is required to select music that is both appropriate for the client's condition and culturally sensitive, while also adhering to professional standards of practice. The correct approach represents best professional practice because it prioritizes a thorough, individualized assessment of the client's response to music and rhythm. This aligns with the core ethical principles of dance/movement therapy, emphasizing client autonomy, beneficence, and non-maleficence. By actively observing and documenting the client's reactions, the therapist ensures that the therapeutic interventions are tailored to their specific needs and are contributing positively to their progress. This systematic approach is supported by the ethical guidelines of the board-certified dance/movement therapist, BCDMT, which mandate that therapists practice within their scope of competence and utilize evidence-informed interventions. The focus on client response and therapeutic goals ensures that the integration of music and rhythm is a deliberate and effective component of the treatment plan, rather than an arbitrary addition. An incorrect approach that involves selecting music solely based on personal preference or popular trends fails to uphold the principle of client-centered care. This could lead to the use of music that is incongruent with the client's emotional state or cultural background, potentially causing discomfort or exacerbating symptoms, which violates the principle of non-maleficence. Another incorrect approach, which is to use music with a highly stimulating tempo and complex rhythm for a client experiencing anxiety without prior assessment, risks overwhelming the client and increasing their distress. This demonstrates a lack of understanding of the potential impact of music on physiological and psychological states, and a failure to adhere to the BCDMT's ethical obligation to avoid harm. Furthermore, an approach that neglects to document the client's responses to music and rhythm fails to establish a clear rationale for its use and hinders the ability to track progress or adjust the intervention, thereby not meeting the standards of professional documentation and accountability expected of a BCDMT. The professional decision-making process for similar situations should involve a systematic evaluation of the client's presenting issues, therapeutic goals, and individual preferences. This includes considering the client's history, cultural background, and any known sensitivities to auditory stimuli. The therapist should then select music and rhythmic elements that are hypothesized to support the therapeutic objectives, while remaining open to adapting these choices based on the client's real-time responses. Continuous observation, active listening, and open communication with the client are crucial for ensuring that the integration of music and rhythm is a dynamic and responsive therapeutic tool. Documentation of these observations and interventions is essential for accountability and for informing future treatment decisions. Question 3. Risk assessment procedures indicate that a client who has a history of significant anxiety is presenting with heightened somatic symptoms of distress as a structured movement activity designed to promote group cohesion is about to begin. The BCDMT is leading the session. What is the most therapeutically appropriate course of action? Option A. Immediately stop the structured movement activity and escort the client out of the session to ensure their immediate safety. Option B. Verbally encourage the client to participate in the original structured movement activity, emphasizing the importance of group participation without acknowledging or addressing their current distress. Option C. Proceed with the original structured movement activity as planned. encouraging the client to push through their anxiety for the benefit of group cohesion. Option D. Assess the client's current level of distress and readiness, and then adapt the structured movement activity to incorporate grounding techniques and offer options for participation that are less demanding, while maintaining a supportive presence. The correct answer is D. Assess the client's current level of distress and readiness, and then adapt the structured movement activity to incorporate grounding techniques and offer options for participation that are less demanding, while maintaining a supportive presence. Explanation. This scenario presents a professional challenge because the BCDMT must balance the therapeutic goals of a structured movement activity with the individual needs and potential limitations of a client experiencing significant anxiety. The core of the challenge lies in adapting a pre-designed activity to ensure it is both effective and safe, without compromising the client's well-being or the integrity of the therapeutic process. Careful judgment is required to assess the client's current state, predict their response to the activity, and intervene appropriately. The correct approach represents best professional practice because it prioritizes client safety and therapeutic efficacy through a process of informed adaptation. By first assessing the client's current state and readiness, the BCDMT can then modify the structured activity to be less overwhelming, incorporating elements that promote grounding and self-regulation. This aligns with the ethical principles of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm. Furthermore, it adheres to the professional standards of practice for dance/movement therapy, which emphasize individualized care and the dynamic adjustment of interventions based on client response. The BCDMT's role is to facilitate growth and healing, which necessitates flexibility and responsiveness to the client's lived experience. An incorrect approach that involves proceeding with the original, unmodified structured activity without considering the client's heightened anxiety would represent a failure to uphold the principle of non-maleficence. This could lead to increased distress, potential re-traumatization, and a breakdown of the therapeutic alliance. It also demonstrates a lack of clinical judgment and an inability to adapt interventions to the client's immediate needs, which is a core competency for a BCDMT. Another incorrect approach, such as abruptly terminating the session or the activity without explanation or offering alternative coping strategies, would be professionally unsound. This could leave the client feeling abandoned, misunderstood, and unsupported, potentially exacerbating their anxiety and damaging their trust in the therapeutic process. It fails to provide the necessary containment and guidance that a BCDMT is trained to offer. A third incorrect approach, such as attempting to force the client to participate in the original activity through verbal encouragement alone, without addressing the underlying anxiety or modifying the activity, would also be ethically problematic. This approach disregards the client's internal experience and can be perceived as dismissive or invalidating, undermining the therapeutic relationship and the effectiveness of the intervention. The professional decision-making process for similar situations should involve a continuous cycle of assessment, intervention, and reassessment. The BCDMT should first conduct a thorough assessment of the client's current emotional and physical state, paying close attention to nonverbal cues. Based on this assessment, they should determine the most appropriate intervention, which may involve modifying a planned activity, introducing grounding techniques, or shifting to a different therapeutic approach. Throughout the session, the BCDMT must remain attuned to the client's responses, ready to adjust the intervention as needed. This dynamic and responsive approach ensures that the therapy remains client-centered, safe, and effective. Question 4. The monitoring system demonstrates that a BCDMT is working with a client from a collectivist culture who expresses discomfort with individualistic self-expression in movement. The therapist is considering various approaches to facilitate therapeutic progress. Which of the following approaches best aligns with ethical and culturally sensitive dance/movement therapy practice? Option A. Integrate group-based movement activities that emphasize shared experience and collective expression, while also exploring how individual contributions can enrich the group dynamic. Option B. Encourage the client to explore individual emotional expression through movement, explaining that this is a core component of dance/movement therapy for personal growth. Option C. Focus solely on the client's verbal processing of emotions, deeming movement therapy less suitable given their cultural background. Option D. Introduce a range of Western contemporary dance techniques, assuming these are universally applicable for emotional release. The correct answer is B. Encourage the client to explore individual emotional expression through movement, explaining that this is a core component of dance/movement therapy for personal growth. Explanation. This scenario presents a professional challenge for a board-certified dance/movement therapist, BCDMT, working with a diverse client population. The core difficulty lies in balancing the universal principles of dance/movement therapy with the specific cultural nuances and social contexts that shape a client's experience, expression, and understanding of movement. A BCDMT must navigate potential biases, avoid imposing their own cultural framework, and ensure that therapeutic interventions are sensitive, respectful, and effective within the client's lived reality. This requires a deep understanding of cultural humility and the ability to adapt therapeutic approaches accordingly. The correct approach represents best professional practice because it prioritizes client-centered care, cultural competence, and adherence to ethical guidelines for BCDMTs. Specifically, it aligns with the ethical imperative to provide services that are sensitive to cultural and social differences, as outlined by professional standards that emphasize non-discrimination and respect for diversity. This approach involves actively seeking to understand the client's cultural background, incorporating culturally relevant movement forms, and collaborating with the client to ensure the therapy is meaningful and empowering. It demonstrates a commitment to avoiding ethnocentrism and promoting therapeutic outcomes that are congruent with the client's values and worldview. An incorrect approach that fails to acknowledge or actively address cultural and social considerations would represent a significant ethical failure. This could manifest as imposing Western-centric movement paradigms without regard for their appropriateness or meaning in another culture, leading to misinterpretation, alienation, or even harm. Such an approach would violate the ethical principle of beneficence, doing good, and non-maleficence, avoiding harm, by potentially causing distress or invalidating the client's cultural identity. Furthermore, it could be seen as discriminatory, failing to provide equitable care due to a lack of cultural awareness. Another incorrect approach might involve making assumptions about a client's cultural background based on stereotypes, rather than engaging in genuine inquiry, which is a form of bias and a failure to uphold professional standards of individual assessment. The professional decision-making process for similar situations should involve a continuous cycle of self-reflection, cultural inquiry, and client collaboration. Professionals must first engage in self-assessment to identify their own cultural biases and assumptions. This should be followed by active learning about the cultural and social backgrounds of their clients, seeking information from reliable sources, and most importantly, directly from the clients themselves. Therapeutic interventions should then be developed and adapted in partnership with the client, ensuring that the chosen movements, themes, and goals are culturally congruent and socially relevant. Ongoing evaluation of the therapeutic process is crucial to ensure that the interventions remain effective and respectful, with a willingness to adjust the approach as needed based on client feedback and evolving understanding. Question 5. Stakeholder feedback indicates a growing diversity in client presentations and a desire for more adaptable therapeutic approaches within the dance/movement therapy program. Considering the foundational theoretical frameworks of dance/movement therapy, which of the following approaches best addresses these evolving needs while maintaining professional integrity? Option A. Critically evaluating and integrating diverse theoretical models, informed by current research and client outcomes, to create a flexible and responsive therapeutic practice. Option B. Prioritizing the adoption of the newest, most avant-garde theoretical trends in dance/movement therapy, even if empirical evidence is limited. Option C. Dismissing stakeholder feedback as anecdotal and focusing solely on the therapist's preferred theoretical orientation. Option D. Strictly adhering to the most historically established theoretical framework, assuming its universal applicability regardless of client diversity or feedback. The correct answer is A. Critically evaluating and integrating diverse theoretical models, informed by current research and client outcomes, to create a flexible and responsive therapeutic practice. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the ethical imperative to provide evidence-based and client-centered dance/movement therapy, DMT, interventions. The challenge lies in balancing the therapist's theoretical orientation with the evolving needs and preferences of the client population, as indicated by stakeholder feedback. A rigid adherence to a single theoretical foundation without considering its efficacy and relevance to the diverse experiences of clients, can lead to suboptimal therapeutic outcomes and potentially violate ethical principles of beneficence and non-maleficence. Careful judgment is required to integrate theoretical knowledge with practical application and client responsiveness. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a dynamic and integrative understanding of DMT theoretical foundations. It acknowledges that while foundational theories provide a crucial framework, effective practice necessitates an adaptive and evidence-informed approach. This involves critically evaluating the applicability of various theoretical models to different client populations and presenting concerns, and being open to integrating diverse theoretical perspectives when appropriate and supported by research and clinical experience. This aligns with the ethical guidelines of the board's Certified Dance/Movement Therapist (BCDMT) credentialing body, which emphasizes the importance of ongoing professional development, evidence-based practice, and client welfare. Specifically, it upholds the principle of providing competent and effective services by staying abreast of current research and best practices in DMT. Incorrect approaches analysis. One incorrect approach fails to acknowledge the importance of empirical evidence and client outcomes in shaping therapeutic practice. Adhering solely to a single, established theoretical model without considering its effectiveness for the current client population, or without exploring alternative or complementary theoretical frameworks, can lead to a stagnant and potentially ineffective therapeutic approach. This could be seen as a failure to uphold the principle of beneficence, as it may not be providing the most beneficial intervention for the client. It also risks violating the principle of non-maleficence if the chosen approach proves ineffective or detrimental. Another incorrect approach might involve prioritizing novel or less established theoretical trends without sufficient critical evaluation or empirical support. While innovation is valuable, a BCDMT has an ethical responsibility to base interventions on sound theoretical principles and evidence of efficacy. Uncritically adopting unproven theories could lead to ineffective or even harmful interventions, directly contravening ethical obligations to clients. This approach neglects the foundational requirement for evidence-based practice and could be seen as a departure from professional competence. A third incorrect approach might involve dismissing stakeholder feedback as irrelevant to theoretical foundations. This demonstrates a lack of responsiveness to the client experience and a potential disconnect between theoretical understanding and practical application. Ethical practice demands that therapists consider the impact of their interventions on clients and be willing to adapt their approach based on client feedback and observed outcomes. Ignoring such feedback can lead to a therapeutic relationship that is not client-centered and may not meet the client's needs, thereby failing to uphold the ethical principle of client autonomy and welfare. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough understanding of established DMT theoretical foundations. This understanding should then be critically applied to the specific client population and presenting concerns, considering the available empirical evidence for different theoretical approaches. Active engagement with stakeholder feedback is crucial for assessing the real-world impact and perceived effectiveness of interventions. Professionals should continuously seek to integrate diverse theoretical perspectives in an evidence-informed and client-centered manner, engaging in ongoing professional development to stay abreast of evolving research and best practices in the field. This iterative process of theoretical grounding, critical application, client responsiveness, and continuous learning ensures ethical and effective practice. Question 6. Investigation of how a board-certified dance/movement therapist might adapt choreographic principles to facilitate a client's processing of grief, considering the client's limited mobility and history of social anxiety. Option A. Focus on teaching the client technically precise dance steps from a specific genre, emphasizing aesthetic form and performance quality to build confidence through mastery of external skills. Option B. Collaboratively explore simple, repetitive movement motifs that symbolize the client's feelings of loss and emptiness, gradually introducing variations in tempo and spatial pathways to encourage emotional expression and a sense of agency. Option C. Utilize large-scale dynamic group choreography that encourages spontaneous interaction and cathartic release, without prior individual assessment of the client's comfort level with group settings or physical demands. Option D. Design and instruct the client in a series of complex, abstract choreographic phrases that explore themes of isolation and resilience, expecting the client to interpret and embody these movements independently. The correct answer is B. Collaboratively explore simple, repetitive movement motifs that symbolize the client's feelings of loss and emptiness, gradually introducing variations in tempo and spatial pathways to encourage emotional expression and a sense of agency. Explanation: this scenario presents a professional challenge for a board-certified dance/movement therapist, BCDMT, due to the inherent subjectivity and potential for misinterpretation when applying choreographic techniques in a therapeutic context. The therapist must navigate the delicate balance between artistic expression and therapeutic efficacy, ensuring that the chosen techniques serve the client's goals without imposing personal artistic preferences or causing distress. Careful judgment is required to select and adapt choreographic elements in a way that is sensitive to the client's physical, emotional, and cognitive state, adhering to ethical guidelines that prioritize client well-being and professional competence. The correct approach, which involves collaboratively exploring movement motifs that reflect the client's internal experience and gradually introducing variations to facilitate emotional processing and insight, represents best professional practice. This method aligns with the ethical principles of client-centered care, informed consent, and the BCDMT's responsibility to utilize evidence-informed practices. By co-creating with the client, the therapist ensures that the choreographic elements are meaningful and relevant to the client's therapeutic journey, fostering a sense of agency and empowerment. This approach respects the client's autonomy and promotes a safe space for exploration, which is paramount in dance/movement therapy. An incorrect approach that involves unilaterally imposing complex, abstract choreographic sequences without assessing the client's readiness or capacity for engagement represents a significant ethical failure. This could lead to client frustration, alienation, and a breakdown of the therapeutic alliance, potentially exacerbating existing issues. Such an approach disregards the principle of do no harm and fails to demonstrate professional competence in adapting techniques to individual needs. Another incorrect approach, focusing solely on the aesthetic quality of the movement rather than its therapeutic potential, also constitutes an ethical lapse. This prioritizes artistic merit over client well-being and therapeutic outcomes, violating the BCDMT's core responsibility. Furthermore, failing to document the rationale behind the chosen choreographic techniques and their observed impact on the client's progress would be a violation of professional record-keeping standards, hindering accountability and continuity of care. The professional decision-making process for similar situations should involve a continuous cycle of assessment, intervention, and evaluation. Therapists must first conduct a thorough assessment of the client's needs, strengths, and limitations, considering their cultural background and personal history. Interventions, including the application of choreographic techniques, should be thoughtfully selected and adapted based on this assessment, with a clear therapeutic rationale. Throughout the process, the therapist must actively monitor the client's responses, both verbal and nonverbal, and be prepared to adjust the approach as needed. Collaboration with the client, seeking their feedback, and involving them in the decision-making process is crucial for ensuring the efficacy and ethical integrity of the therapy. Regular supervision and consultation with peers can also provide valuable support in navigating complex cases and ensuring adherence to professional standards. Question 7. What factors determine the appropriate dance/movement therapy intervention when a client presents with increasing agitation and a history of impulsive behavior, while also expressing a desire for vigorous movement? Option A. Immediately terminating the session or imposing severe restrictions on all movement due to the observed agitation and history of impulsive behavior. Option B. Relying solely on the client's verbal assurance of feeling fine, despite observable signs of agitation and a history of impulsive behavior. Option C. Proceeding with a highly energetic and potentially disinhibiting movement intervention as requested by the client to address their expressed desire for vigorous movement. Option D. A comprehensive risk assessment that evaluates the client's current emotional state, cognitive capacity, potential for harm to self or others, and the safety of the therapeutic environment, informing the adaptation or modification of interventions. The correct answer is D. A comprehensive risk assessment that evaluates the client's current emotional state, cognitive capacity, potential for harm to self or others, and the safety of the therapeutic environment, informing the adaptation or modification of interventions. Explanation. This scenario is professionally challenging because it requires a dance/movement therapist, DMT, to navigate the complex interplay of a client's evolving presentation, potential safety risks, and the ethical imperative to provide appropriate and effective therapeutic interventions. The DMT must balance the client's immediate needs and expressed desires with a thorough risk assessment that considers both the client's internal state and external environmental factors. The core challenge lies in making an informed decision about the most suitable intervention when the client's behavior suggests a potential for harm, either to themselves or others, without prematurely limiting therapeutic exploration or imposing undue restrictions. The correct approach represents best professional practice because it prioritizes client safety while maintaining therapeutic efficacy. A comprehensive risk assessment, grounded in the ethical principles of beneficence and non-maleficence, is paramount. This involves systematically evaluating the likelihood and severity of potential harm, considering factors such as the client's history, current emotional state, cognitive functioning, and the therapeutic environment. The decision to modify or adapt interventions based on this assessment, rather than abruptly terminating or rigidly adhering to a pre-planned sequence, aligns with the ethical guidelines for board-certified dance/movement therapists, which emphasize client well-being and the responsible application of therapeutic techniques. This approach ensures that interventions are tailored to the client's current capacity and safety needs, fostering a secure therapeutic alliance. An incorrect approach would be to proceed with a highly energetic and potentially disinhibiting movement intervention without a thorough risk assessment. This fails to uphold the ethical duty to protect the client from harm, as it disregards potential escalations of distress or impulsive behaviors that could arise from the intervention. Such an action could be seen as a violation of the principle of non-maleficence, as it knowingly exposes the client to an increased risk of negative outcomes. Another incorrect approach would be to immediately terminate the session or impose severe restrictions on movement solely based on the initial observation of agitation, without a nuanced assessment of the underlying causes or the potential benefits of carefully managed movement. This could be interpreted as a failure to provide appropriate care and could be detrimental to the therapeutic process, potentially alienating the client and hindering their progress. It also fails to consider the potential for movement itself to be a regulatory tool for the client. A further incorrect approach would be to rely solely on the client's verbal report of feeling fine, despite observable signs of distress or agitation, without independently verifying their safety. This neglects the DMT's professional responsibility to observe and interpret nonverbal cues and to conduct an objective risk assessment, potentially leading to a misjudgment of the client's actual state and an inadequate response to emergent risks. The professional decision-making process for similar situations should involve a continuous cycle of observation, assessment, intervention, and reassessment. Professionals must cultivate a heightened awareness of both verbal and nonverbal client presentations, integrate this information with their knowledge of therapeutic modalities and potential risks, and be prepared to adapt their approach dynamically. This requires a strong understanding of ethical codes, a commitment to ongoing professional development, and the ability to consult with supervisors or colleagues when faced with complex ethical dilemmas or safety concerns. The ultimate goal is to provide a safe, supportive, and therapeutically effective environment that promotes client growth and well-being. Question 8. When evaluating a young child presenting with significant behavioral challenges and limited verbal communication, and considering the application of developmental approaches in dance/movement therapy, which of the following best guides the BCDMT's initial assessment and intervention planning? Option A. Conduct a series of individual sessions with the child to identify underlying issues, delaying caregiver involvement until a clear diagnosis is established. Option B. Focus on implementing structured movement exercises designed to immediately suppress the challenging behaviors without extensive initial caregiver consultation. Option C. Prioritize observing the child's spontaneous movement patterns and interactions within their environment, and collaboratively develop a therapeutic plan with caregivers that is informed by the child's developmental stage and identified needs. Option D. Directly impose adult-oriented therapeutic goals onto the child's movement exploration, assuming that adult coping mechanisms will translate to child-appropriate strategies. The correct answer is C. Prioritize observing the child's spontaneous movement patterns and interactions within their environment, and collaboratively develop a therapeutic plan with caregivers that is informed by the child's developmental stage and identified needs. Explanation: this scenario is professionally challenging because it requires the BCDMT to balance the immediate needs of a child with the long-term developmental goals, while also considering the ethical imperative to involve caregivers in the therapeutic process. The BCDMT must navigate the complexities of a child's limited verbal expression and the potential for caregiver misinterpretation of the child's behavior. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of the child's developmental stage and integrates this understanding into a collaborative plan with the caregivers. This aligns with ethical guidelines that emphasize client autonomy, including family involvement when appropriate, and the importance of a holistic, strengths-based approach. By observing the child's movement patterns in relation to their developmental milestones, the BCDMT can identify specific areas for intervention that are developmentally appropriate and meaningful for the child. Engaging caregivers ensures continuity of care and empowers them to support the child's progress outside of sessions, fostering a more effective and sustainable therapeutic outcome. This approach respects the child's unique developmental trajectory and the family system. An incorrect approach that focuses solely on addressing the immediate behavioral manifestation without considering the underlying developmental context fails to provide a comprehensive and effective intervention. This could lead to superficial changes that do not address the root cause of the behavior and may not be sustainable. Ethically, this approach could be seen as not fully meeting the client's needs by neglecting a crucial aspect of their development. Another incorrect approach that bypasses caregiver involvement is ethically problematic. While the child is the primary client, caregivers are integral to the child's support system. Excluding them from the process can undermine the therapeutic alliance, create potential for misunderstanding, and limit the effectiveness of the intervention by failing to leverage the caregiver's knowledge of the child and their ability to reinforce therapeutic gains. This violates principles of informed consent and collaborative care. A third incorrect approach that imposes adult-centric therapeutic goals onto a child's developmental needs ignores the fundamental principles of developmental psychology and dance/movement therapy. Children's therapeutic needs and capacities are distinct from adults, and interventions must be tailored to their specific developmental stage. Failing to do so can be ineffective and potentially detrimental, as it may not resonate with the child or may create undue pressure. The professional decision-making process for similar situations involves a thorough assessment of the client's developmental stage, a clear understanding of the therapeutic goals, and a commitment to collaborative practice with caregivers. The BCDMT should always strive to gather information from multiple sources, including direct observation, caregiver reports, and any relevant professional records. Interventions should be evidence-based and developmentally informed, with a clear rationale for their selection. Open communication and ongoing dialogue with caregivers are essential to ensure that the therapeutic plan is understood, supported, and integrated into the child's daily life. Question 9. The efficiency study reveals that a new, proprietary assessment tool for evaluating emotional expression through movement has been developed by a private company. This tool claims to offer rapid insights into a client's affective state. As a BCDMT, you are considering its use for a diverse adolescent population. Which of the following approaches best aligns with the regulatory framework and ethical guidelines for board-certified dance/movement therapists? Option A. Relying solely on the marketing materials provided by the company to determine the tool's suitability, given the company's assurance of its effectiveness. Option B. Implementing the tool and gathering informal feedback from clients to gauge its perceived usefulness, without formal validation or adherence to established assessment protocols. Option C. Conducting a thorough review of the tool's psychometric properties, including its reliability, validity, and cultural responsiveness, and consulting existing literature and professional guidelines before considering its implementation. Option D. Adopting the new tool immediately due to its purported efficiency and the potential for quicker client progress, assuming its novelty implies advanced methodology. The correct answer is D. Adopting the new tool immediately due to its purported efficiency and the potential for quicker client progress, assuming its novelty implies advanced methodology. Explanation. This scenario presents a professional challenge because it requires a board-certified dance/movement therapist, BCDMT, to select an assessment tool that is not only clinically appropriate but also adheres to the ethical and regulatory standards governing the profession. The core of the challenge lies in balancing the need for effective assessment with the imperative to use validated, culturally sensitive, and ethically sound methods, all within the framework of professional practice guidelines. Careful judgment is required to ensure that the chosen tool accurately reflects the client's experience without introducing bias or compromising client welfare. The correct approach represents best professional practice because it prioritizes the use of assessment tools that are evidence-based, culturally competent, and aligned with the ethical principles of the American Dance Therapy Association, ATA Code of Ethics. Specifically, utilizing a tool that has demonstrated reliability and validity for the target population, and which has been developed with consideration for diverse cultural backgrounds, ensures that the assessment is both accurate and respectful. This aligns with the ATA emphasis on professional competence, informed consent, and avoiding harm, which are foundational to ethical practice. An incorrect approach that relies on a tool lacking empirical support or validation for the specific client population would represent a failure in professional competence. This could lead to inaccurate diagnostic impressions or treatment planning, potentially causing harm to the client. Furthermore, using a tool that has not been vetted for cultural appropriateness could perpetuate biases and misunderstandings, violating the ethical principle of cultural sensitivity and respect for diversity. Another incorrect approach might involve using a tool without obtaining informed consent regarding its purpose, limitations, and how the results will be used. This would be a direct violation of the ATA ethical guidelines regarding informed consent and client autonomy. Professionals should employ a decision-making process that begins with a thorough understanding of the client's presenting concerns, cultural background, and developmental stage. This understanding should then guide the selection of assessment tools, prioritizing those that are evidence-based, culturally sensitive, and ethically sound. A critical evaluation of available tools, considering their psychometric properties, cultural adaptations, and alignment with professional ethical standards, is essential. Consultation with supervisors or peers, particularly when faced with complex cases or unfamiliar assessment methods, is also a crucial component of professional decision-making. Question 10. Market research demonstrates that clients seeking dance/movement therapy often present with a complex interplay of physical, emotional, and social challenges. A board-certified dance/movement therapist, BCDMT, is observing a new client during an initial session. The therapist aims to gather comprehensive data about the client's movement patterns to inform the development of a therapeutic plan. Which of the following approaches to movement observation and analysis would best align with the ethical and professional standards for a BCDMT? Option A. Relying primarily on personal impressions and subjective feelings about the client's movement, focusing on what the therapist finds aesthetically pleasing or interesting. Option B. Focusing exclusively on the client's ability to perform specific dance steps or sequences accurately, assessing their technical proficiency. Option C. Utilizing a single, predefined theoretical model of movement analysis that is applied uniformly to all clients, irrespective of their individual backgrounds or presenting concerns. Option D. Employing a standardized movement observation and analysis system that considers observable qualities such as space, time, and energy, and their potential clinical correlations, while remaining open to individual and cultural variations. The correct answer is D. Employing a standardized movement observation and analysis system that considers observable qualities such as space, time, and energy, and their potential clinical correlations, while remaining open to individual and cultural variations. Explanation. This scenario presents a professional challenge because the dance/movement therapist, DMT, is tasked with observing and analyzing movement in a context that requires sensitivity to potential cultural nuances and individual differences, while also adhering to professional standards of practice. The core of the challenge lies in balancing objective movement analysis with subjective interpretation, ensuring that the analysis is both clinically relevant and ethically sound, avoiding bias and promoting client well-being. Careful judgment is required to select an analytical framework that is comprehensive yet adaptable to the specific client and setting. The correct approach represents best professional practice because it prioritizes a systematic and evidence-informed method for movement observation and analysis. This approach aligns with the ethical guidelines and professional standards expected of board-certified dance/movement therapists, which emphasize the importance of using validated assessment tools and techniques. By focusing on observable movement qualities and their potential clinical implication, the DMT can generate objective data that informs treatment planning and progress monitoring. This systematic approach minimizes the risk of subjective bias and ensures that the analysis is grounded in the client's actual movement patterns, thereby supporting effective therapeutic interventions and upholding the integrity of the profession. Adherence to established frameworks ensures that the DMT is operating within the scope of practice and meeting the standards of care expected by regulatory bodies and clients. An incorrect approach that relies solely on anecdotal observations and personal intuition fails to meet professional standards. This approach is ethically problematic as it lacks objectivity and can lead to biased interpretations, potentially misinforming treatment decisions and harming the client. It also violates the principle of evidence-based practice, which is a cornerstone of ethical and effective therapeutic work. Another incorrect approach that focuses exclusively on the aesthetic qualities of movement, without considering the functional or emotional aspects, is also professionally unacceptable. While aesthetics can be a component of movement, a DMT's analysis must be clinically relevant and geared towards therapeutic goals. Ignoring the functional and emotional dimensions of movement would be a failure to conduct a comprehensive assessment, potentially overlooking crucial information for client care and contravening the core principles of dance/movement therapy. A further incorrect approach that applies a single, rigid analytical model to all clients, regardless of their background or presenting issues, demonstrates a lack of cultural competence and clinical flexibility. This can lead to misinterpretations and an inability to capture the full spectrum of a client's experience, potentially alienating or misdiagnosing individuals. Ethical practice demands adaptability and a client-centered approach, which includes recognizing and respecting diversity in movement expression. The professional decision-making process for similar situations should involve a systematic evaluation of the client's needs, the therapeutic goals, and the available assessment tools. Professionals should consider the evidence base for different movement observation and analysis frameworks, their own competencies, and the ethical implications of each approach. A critical self-reflection on potential biases and a commitment to ongoing professional development are essential for ensuring that observations and analyses are accurate, ethical, and therapeutically beneficial. This involves a continuous cycle of assessment, intervention, and reevaluation, guided by professional standards and client-centered care. Question 11. The control framework reveals that when a client describes a vague sensation of tightness in their chest during a dance/movement therapy session, what is the most ethically and therapeutically sound approach for the board-certified dance/movement therapist to facilitate increased body awareness? Option A. Focus on analyzing the potential psychological meaning of chest tightness based on common symbolic interpretation, without directly engaging the client's somatic experience. Option B. Immediately suggest specific breathing exercises to release the chest tightness, assuming the sensation is purely physiological and requires a direct intervention. Option C. Encourage the client to simply ignore the sensation and continue with the planned movement sequence, as focusing on discomfort can hinder progress. Option D. Invite the client to explore the sensation through movement, asking open-ended questions about how the tightness feels, where it moves, and what qualities it possesses, while also verbally processing their experience. The correct answer is D. Invite the client to explore the sensation through movement, asking open-ended questions about how the tightness feels, where it moves, and what qualities it possesses, while also verbally processing their experience. Explanation. This scenario presents a professional challenge due to the inherent subjectivity in assessing somatic experiences and body awareness, coupled with the ethical imperative to provide evidence-based and client-centered care within the BCDMT framework. The therapist must navigate the client's subjective report with objective observation and therapeutic skill, ensuring interventions are both appropriate and ethically sound. Careful judgment is required to differentiate between genuine somatic insights and potential transference or countertransference issues, all while respecting client autonomy and confidentiality. The correct approach represents best professional practice, because it prioritizes a client-led exploration of somatic experience, grounded in the BCDMT's commitment to embodied understanding and self-discovery. This approach aligns with ethical guidelines that emphasize respecting the client's internal experience and facilitating their own awareness. By integrating verbal processing with embodied exploration, the therapist supports a holistic understanding of the client's challenges, fostering deeper insight and agency. This is consistent with the BCDMT's scope of practice, which focuses on using movement and the body as primary tools for therapeutic change, respecting the client's unique somatic narrative. An incorrect approach that relies solely on the therapist's interpretation of the client's movements, without validating the client's subjective experience, fails to uphold the client-centered nature of dance/movement therapy. This can lead to misinterpretations, disempowerment of the client, and a violation of ethical principles that mandate collaboration and respect for the client's lived reality. Such an approach risks imposing the therapist's agenda rather than facilitating the client's own discovery, potentially causing harm by invalidating their internal world. Another incorrect approach that focuses exclusively on cognitive understanding of somatic sensations, neglecting the embodied aspect, misses the core modality of dance/movement therapy. This would be a failure to adhere to the BCDMT's foundational principles, which leverage the body's inherent wisdom. Ethically, it would represent a deviation from the agreed-upon therapeutic modality, potentially leading to ineffective treatment and a breach of professional competence. A third incorrect approach that involves imposing specific somatic techniques without assessing the client's readiness or receptivity disregards the principle of therapeutic appropriateness and client safety. This could lead to resistance, discomfort, or even re-traumatization, violating ethical obligations to do no harm and to practice within one's scope of competence. It fails to acknowledge the dynamic and responsive nature of therapeutic intervention. Professional decision-making in such situations requires a continuous process of assessment, attunement, and ethical reflection. Therapists should begin by establishing a strong therapeutic alliance, fostering an environment of trust and safety. They must then engage in active listening, both verbally and non-verbally, to understand the client's presenting concerns and their subjective experience of their body. Interventions should be collaboratively designed, with the therapist offering options and inviting the client's participation in choosing and adapting techniques. Ongoing assessment of the client's responses, both somatic and emotional, is crucial, allowing for adjustments to the therapeutic plan. Ethical considerations, including confidentiality, informed consent, and professional boundaries, must be consistently integrated into every stage of the therapeutic process. Question 12. Cost-benefit analysis shows that integrating a client's specific cultural movement practices into a therapeutic framework yields significant positive outcomes. But the therapist must choose between a model that is highly adaptable and broadly applicable versus one that is deeply rooted in specific psychodynamic principles of embodiment. Which theoretical model selection best aligns with the core tenets of board-certified dance/movement therapy practice when considering both efficacy and ethical application? Option A. A model that relies on a generalized, nonspecific approach to movement, assuming all movement interventions are inherently therapeutic regardless of theoretical grounding or client specificity. Option B. A model that integrates established psychodynamic principles of embodiment with a flexible framework for incorporating diverse cultural movement expressions, ensuring client-centered and culturally sensitive interventions. Option C. A model that prioritizes a purely somatic approach, focusing solely on the physical sensations of movement without explicit integration of psychological theory or cultural context. Option D. A model that exclusively utilizes a theoretical framework from a different therapeutic discipline, such as cognitive behavioral therapy, and attempts to retrofit dance/movement into its existing structure without considering DMT-specific theoretical foundations. The correct answer is B. A model that integrates established psychodynamic principles of embodiment with a flexible framework for incorporating diverse cultural movement expressions, ensuring client-centered and culturally sensitive interventions. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a dance/movement therapist, DMT, to select a theoretical model that not only aligns with the client's needs, but also adheres to the ethical and professional standards set forth by the board-certified dance/movement therapist, BCDMT, credentialing body. The cost-benefit framing implies a need for efficacy and resource consideration, but the primary driver must be client well-being and adherence to established theoretical frameworks that guide practice. The challenge lies in balancing theoretical appropriateness with practical application and ensuring the chosen model is evidence-informed and ethically sound within the BCDMT scope of practice. Correct approach analysis. The correct approach prioritizes a theoretical model that is well established within the field of dance/movement therapy and directly addresses the client's presenting concerns in a manner consistent with the BCDMT's ethical guidelines. This involves selecting a model that offers a clear rationale for its application, has demonstrated efficacy in similar populations, and respects the client's autonomy and cultural context. The BCDMT framework emphasizes evidence-based practice and the application of theoretical principles that are foundational to the profession, ensuring that interventions are not only beneficial but also professionally responsible and ethically grounded. Incorrect approaches analysis. An incorrect approach would involve selecting a theoretical model that is not recognized within the BCDMT framework, is based on anecdotal evidence rather than established theory, or is applied without considering the client's specific needs and cultural background. For instance, adopting a purely somatic approach without integrating its movement-based principles into a broader therapeutic context, or relying on a model that lacks empirical support within DMT, would represent a failure to adhere to professional standards. Another failure would be to prioritize a model based solely on its perceived ease of implementation or perceived cost-effectiveness, without a strong theoretical or ethical justification for its use with the specific client. This could lead to ineffective or even harmful interventions, violating the BCDMT's commitment to client welfare and professional integrity. Professional reasoning. Professionals should engage in a systematic process of assessment, theoretical grounding, and ethical consideration. This involves 1. Thoroughly assessing the client's needs, goals, and cultural context. 2. Reviewing established theoretical models within dance/movement therapy that are relevant to the client's presentation. 3. Evaluating the evidence base and ethical implications of each potential model. 4. Collaborating with the client to determine the most appropriate and mutually agreed-upon therapeutic approach. 5. Continuously monitoring the effectiveness of the chosen model and making adjustments as needed, always in alignment with BCDMT ethical standards and scope of practice. Question 13. System analysis indicates a board-certified dance/movement therapist, BCDMT, is working with a client who, during a session focused on exploring early attachment patterns through movement improvisation, begins to express strong feelings of idealization and dependence towards the therapist, mirroring past relational dynamics. The therapist recognizes this as a significant transference phenomenon. Considering the psychodynamic framework guiding the therapy, what is the most therapeutically appropriate and ethically sound response for the BCDMT? Option A. Directly interpret the transference to the client, explaining that their feelings are a projection of past relationships and not reflective of the current therapeutic reality. Option B. Acknowledge the client's expressed feelings and gently invite them to explore these sensations and their origins through movement, connecting the embodied experience to the transference. Option C. Ignore the client's expressed feelings and continue with the planned movement exercises, focusing solely on the objective exploration of attachment patterns. Option D. Shift the session's focus entirely to verbal processing of the client's feelings, suspending the movement-based exploration until the transference is resolved. The correct answer is B. Acknowledge the client's expressed feelings and gently invite them to explore these sensations and their origins through movement, connecting the embodied experience to the transference. Explanation. This scenario presents a professional challenge due to the inherent complexity of applying psychodynamic principles within the scope of dance/movement therapy, particularly when dealing with a client exhibiting significant transference. The BCDMT must navigate the ethical imperative to provide effective therapeutic intervention while maintaining professional boundaries and ensuring client safety. The challenge lies in discerning when to directly address transference dynamics through a psychodynamic lens and when to maintain a more present-focused, embodied approach, all within the ethical guidelines of the American Dance Therapy Association, EDTA, and relevant state licensing boards for mental health professionals. Correct approach, which involves acknowledging and exploring the transference in a way that is integrated with the movement experience, represents best professional practice. This aligns with the IDTA Code of Ethics, which emphasizes the importance of understanding the therapeutic relationship and its impact on the client's process. By facilitating the client's exploration of these feelings through movement, the therapist can help the client gain insight into their relational patterns, a core tenet of psychodynamic therapy. This method respects the client's internal world while utilizing the unique modality of dance/movement therapy to facilitate healing and self-awareness. It also adheres to principles of informed consent and client autonomy by involving the client in the exploration of their own internal experiences. An incorrect approach would be to ignore or dismiss the transference. This would be a failure to adhere to the psychodynamic framework being utilized, and a potential ethical lapse under the IDTA Code of Ethics, which calls for therapists to be aware of and manage countertransference and transference. Ignoring these dynamics can hinder therapeutic progress and may even be detrimental to the client's well-being, as it fails to address a significant aspect of their psychological landscape. Another incorrect approach would be to engage in a purely analytical, verbal discussion of the transference without integrating it into the movement work. This would deviate from the core principles of dance/movement therapy, which emphasizes the integration of mind, body, and spirit. Such an approach might also overstep the boundaries of the BCDMT scope of practice if it becomes solely a verbal psychotherapy session, without leveraging the unique benefits of the movement modality. This could also raise ethical concerns regarding the appropriate use of therapeutic techniques and the potential for misapplication of psychodynamic theory outside the context of embodied experience. Professionals should employ a decision-making process that begins with a thorough assessment of the client's presentation and the therapeutic relationship. When psychodynamic principles are being applied, it is crucial to remain attuned to transference and countertransference dynamics. The therapist should then consider how these dynamics manifest within the movement experience. Ethical guidelines, such as those provided by the IDTA, should be consulted to ensure that interventions are appropriate and client-centered. Supervision or consultation with experienced colleagues is also a vital component of professional decision-making, especially when navigating complex transference issues within a specialized therapeutic modality. The therapist must continually evaluate the effectiveness of their interventions and be prepared to adjust their approach based on the client's response and ongoing ethical considerations. Question 14. Risk assessment procedures indicate that a board-certified dance/movement therapist, BCDMT, is working with a new client presenting with significant anxiety and somatic tension. The BCDMT needs to select an appropriate movement assessment protocol to inform the treatment plan. Which of the following approaches best reflects adherence to professional standards and ethical practice for this situation? Option A. Choose the movement assessment protocol that the BCDMT is most familiar with and has used successfully in previous, unrelated clinical settings. Option B. Select a movement assessment protocol that has been empirically validated for use with populations experiencing anxiety and somatic symptoms, and that aligns with the BCDMT's theoretical orientation and the client's cultural background. Option C. Opt for a movement assessment protocol that is quick and easy to administer, prioritizing efficiency over a comprehensive understanding of the client's movement patterns. Option D. Utilize a movement assessment protocol that is widely recognized in the general public, even if its psychometric properties for clinical use are not well established. The correct answer is B. Select a movement assessment protocol that has been empirically validated for use with populations experiencing anxiety and somatic symptoms, and that aligns with the BCDMT's theoretical orientation and the client's cultural background. Explanation. This scenario presents a professional challenge because the BCDMT must select a movement assessment protocol that is not only clinically appropriate for the client's presenting issues, but also aligns with the ethical and legal standards governing dance/movement therapy practice within the specified jurisdiction. The core of the challenge lies in balancing client-centered care with adherence to professional guidelines, ensuring the chosen protocol is valid, reliable, and ethically administered. Careful judgment is required to avoid bias, ensure client safety, and maintain professional integrity. The correct approach represents best professional practice because it prioritizes a systematic, evidence-informed selection process that considers the client's unique needs and the psychometric properties of the assessment. This aligns with the ethical imperative to provide competent and effective services, as mandated by professional standards that emphasize the use of validated tools and techniques. Furthermore, it reflects a commitment to ongoing professional development and the responsible application of knowledge, ensuring that the assessment serves the therapeutic goals without causing harm or misrepresenting the client's condition. Adherence to these principles is crucial for maintaining client trust and upholding the reputation of the profession. An incorrect approach that relies solely on personal preference or familiarity with a protocol, without considering its suitability for the specific client or its psychometric validity, represents a failure in professional competence. This could lead to inaccurate assessments, inappropriate treatment planning, and potentially harm to the client. Ethically, this violates the principle of beneficence and non-maleficence. Another incorrect approach that involves using a protocol without understanding its underlying theoretical framework or its limitations demonstrates a lack of due diligence. This can result in misinterpretation of results and a failure to provide truly individualized care, which is a breach of ethical practice and potentially regulatory requirements for evidence-based practice. A further incorrect approach that disregards the client's cultural background or personal preferences when selecting a movement assessment protocol can lead to alienation, mistrust, and an incomplete or biased understanding of the client's experience. This is an ethical failure to respect client autonomy and cultural sensitivity, and it undermines the therapeutic alliance. The professional decision-making process for similar situations should involve a multifaceted approach. 1. Client assessment. Thoroughly understand the client's presenting issues, goals, history, and cultural context. 2. Protocol review. Research and critically evaluate available movement assessment protocols based on their theoretical underpinnings, psychometric properties, validity, reliability, appropriateness for the client population and presenting issues, and ease of administration. 3. Ethical and legal considerations. Ensure the chosen protocol aligns with professional ethical codes and any relevant jurisdictional regulations regarding assessment and client care. 4. Informed consent. Discuss the chosen assessment with the client, explaining its purpose, procedures, and potential outcomes, and obtain informed consent. 5. Adaptation and flexibility. Be prepared to adapt or modify protocols as needed while maintaining their integrity and ethical application to best serve the individual client. 6. Supervision and consultation. Seek supervision or consultation when faced with complex cases or uncertainty regarding assessment choices. Question 15. Cost-benefit analysis shows that while direct emotional mirroring might seem like a quick way to build rapport with a client experiencing intense PTSD symptoms during a dance/movement therapy session, it carries significant risks. Considering the BCDMT's ethical obligations and the principles of trauma-informed care, which of the following represents the most therapeutically sound and ethically responsible approach when a client begins to exhibit profound emotional distress and somatic expressions indicative of past trauma? Option A. The therapist immediately mirrors the client's intense emotional expressions and movements, aiming to create a sense of shared experience and deep connection. Option B. The therapist abruptly ends the session, citing the intensity of the client's emotional display as beyond the scope of the current session's capacity. Option C. The therapist facilitates a contained somatic release by offering grounding techniques and gentle, rhythmic movements to help the client regulate their nervous system, while verbally acknowledging and validating the client's experience without mirroring the intensity of their emotions. Option D. The therapist attempts to quickly redirect the client's movements and emotional expression towards more neutral or positive themes to de-escalate the intensity of the experience. The correct answer is C. The therapist facilitates a contained somatic release by offering grounding techniques and gentle, rhythmic movements to help the client regulate their nervous system, while verbally acknowledging and validating the client's experience without mirroring the intensity of their emotions. Explanation. This scenario presents a common challenge in dance/movement therapy, DMT practice, balancing the immediate need for trauma-informed care with the ethical imperative of maintaining professional boundaries and ensuring client safety. The BCDMT must navigate the complexities of a client's intense emotional expression, which may be a direct manifestation of their PTSD, while adhering to the ethical codes and practice guidelines established by the IDTA American Dance Therapy Association, which govern BCDMTs in the United States. The professional challenge lies in discerning when to offer direct support and when to maintain a therapeutic distance to avoid re-traumatization or the development of an unhealthy therapeutic relationship. The correct approach prioritizes the client's immediate emotional state and safety within a structured, trauma-informed DMT framework. This involves acknowledging the client's distress, validating their experience, and offering contained, embodied interventions that facilitate processing and regulation without overwhelming the client. This aligns with ETA ethical principles that emphasize client welfare, competence, and the avoidance of harm. Specifically, it reflects the principle of do no harm by ensuring interventions are appropriate for trauma survivors and do not inadvertently trigger or exacerbate symptoms. It also upholds the principle of beneficence by actively working towards the client's healing and well-being through evidence-based DMT techniques. The therapist's role is to provide a safe container for this expression, utilizing their training in trauma-informed DMT to guide the process towards integration and resilience. An incorrect approach that involves the therapist mirroring the client's distress or becoming overly emotionally entangled would violate the ethical principle of maintaining professional boundaries. This can lead to vicarious trauma for the therapist and blur the lines of the therapeutic relationship, potentially hindering the client's progress and even causing harm. Another incorrect approach, such as immediately attempting to fix the client's emotions or redirecting them to a less intense activity without acknowledging their current state, fails to honor the client's experience and can be perceived as dismissive, undermining the therapeutic alliance and potentially re-traumatizing the client by invalidating their feelings. This disregards the ETA emphasis on client-centered care and the importance of a gradual, paced approach to trauma processing. A third incorrect approach, such as abruptly ending the session due to the intensity of the client's expression without proper containment or a plan for follow-up, would be a significant ethical failure, potentially leaving the client feeling abandoned and unsafe, directly contravening the ETA commitment to client safety and continuity of care. Professional decision-making in such situations requires a strong foundation in trauma-informed DMT principles, a thorough understanding of the ETA ethical code, and ongoing self-reflection. The therapist must continuously assess the client's state, their own emotional responses, and the efficacy of their interventions. This involves a process of attunement, containment, and graduated exposure, always prioritizing the client's safety and therapeutic goals. When in doubt, consulting with supervisors or experienced colleagues is a crucial step in ensuring ethical and effective practice. Question 16. The efficiency study reveals that a BCDMT's understanding of the field's historical trajectory significantly impacts their current practice. Which of the following historical perspectives best informs contemporary, ethically sound dance/movement therapy practice? Option A. A chronological recounting of major dance styles and their cultural contexts, viewing dance/movement therapy solely as an extension of artistic expression, rather than a distinct therapeutic discipline with its own ethical and regulatory framework. Option B. An exclusive focus on the methodologies of a single, pioneering figure whose early work laid some groundwork, prioritizing their specific techniques over broader theoretical and ethical advancements in the field. Option C. A comprehensive understanding of the field's evolution, acknowledging key theoretical shifts and the development of ethical guidelines, while critically evaluating the relevance and ethical implications of historical approaches for current client populations and professional standards. Option D. A deep dive into the earliest, often uncodified, intuitive movement practices that predated formal therapeutic recognition, focusing on their raw expressive potential without regard for subsequent professional development. The correct answer is C. A comprehensive understanding of the field's evolution, acknowledging key theoretical shifts and the development of ethical guidelines, while critically evaluating the relevance and ethical implications of historical approaches for current client populations and professional standards. Explanation. This scenario presents a professional challenge because it requires a board-certified dance/movement therapist, BCDMT, to critically evaluate the historical context of their practice in relation to current ethical standards and regulatory frameworks. The BCDMT must discern which historical influences are foundational and ethically sound for contemporary practice, and which might represent outdated or potentially harmful approaches that are no longer aligned with professional guidelines. This requires a nuanced understanding of the evolution of dance/movement therapy, moving beyond simple chronological recounting to an ethical and professional assessment. The correct approach represents best professional practice because it demonstrates an understanding of the foundational principles of dance/movement therapy, while critically assessing their relevance and ethical implications in the current professional landscape. It acknowledges the historical development of the field, including the contributions of key figures and theoretical shifts, but prioritizes approaches that are evidence-based, client-centered, and adhere to the ethical codes and regulatory standards governing BCDMTs. This approach ensures that the therapist's practice is informed by history, but not constrained by outdated or ethically questionable methodologies, aligning with the mandate to provide safe and effective care. An incorrect approach that focuses solely on the earliest, less formalized origins of dance/movement therapy, without considering its subsequent development and ethical refinement, would be professionally unacceptable. This would fail to acknowledge the rigorous development of the profession, the establishment of ethical codes, and the importance of evidence-based practice. Such an approach could lead to the application of techniques that are not supported by current research or that may inadvertently cause harm, violating the BCDMT's ethical obligation to clients and the profession's standards. Another incorrect approach that emphasizes a single, potentially controversial historical figures methods without contextualizing them within the broader evolution of the field and current ethical guidelines would also be a failure. This narrow focus ignores the diverse influences and the professional consensus that has shaped dance/movement therapy into its current form. It risks perpetuating practices that may be ethically problematic or scientifically unsupported, disregarding the professional responsibility to integrate diverse historical perspectives with contemporary best practices. The professional decision-making process for similar situations should involve a continuous cycle of critical reflection. Therapists should actively engage with the history of their profession, not just as a matter of record, but as a source for understanding the ethical and theoretical underpinnings of current practices. This involves seeking out diverse historical accounts, understanding the socio-cultural context in which early practices emerged, and critically evaluating how these have been refined, challenged, and integrated into contemporary ethical codes and regulatory frameworks. When assessing historical influences, the guiding principle should always be alignment with current ethical standards, client well-being, and the professional responsibilities outlined by the credentialing body. Question 17. Governance review demonstrates that a board-certified dance/movement therapist, BCDMT, is working with an adult client who presents with significant anxiety. The client frequently discusses their feelings of being overwhelmed by their parents' expectations and their difficulty in establishing personal boundaries within the family. The BCDMT is considering how to best apply systems theory to this case. Which of the following approaches most accurately reflects a systemic perspective in dance/movement therapy? Option A. Focus on the client's individual somatic responses to anxiety and develop movement interventions that promote self-regulation and emotional expression, while educating the client on identifying and articulating their personal boundaries within the family context. Option B. Recommend that the client distance themselves from their family to reduce anxiety, without exploring the underlying systemic patterns that contribute to the client's current relational challenges. Option C. Directly engage the client's parents in therapy sessions to explore their expectations and communication patterns, without first obtaining the client's explicit consent for this expanded scope of treatment. Option D. Primarily focus on the client's internal psychological narrative and past trauma, assuming that resolving individual issues will naturally lead to improved family dynamics. The correct answer is A. Focus on the client's individual somatic responses to anxiety and develop movement interventions that promote self-regulation and emotional expression, while educating the client on identifying and articulating their personal boundaries within the family context. Explanation. This scenario presents a professional challenge because the BCDMT must navigate the complex interplay of individual client needs within a family system, while adhering to ethical guidelines that prioritize client well-being and professional competence. The challenge lies in applying systems theory principles to a real-world clinical situation where multiple interconnected factors influence the client's progress, and the therapist's interventions must be both theoretically sound and ethically responsible. Careful judgment is required to ensure that interventions are not only effective for the identified client, but also consider the broader systemic dynamics and potential impact on other family members, even if they are not directly participating in therapy. The correct approach represents best professional practice because it directly addresses the core tenets of systems theory by acknowledging the client as part of a larger relational context. This approach aligns with the ethical principles of the American Dance Therapy Association, ATA Code of Ethics, specifically those pertaining to competence, client welfare, and informed consent. By focusing on the client's role and interactions within the family system, the BCDMT demonstrates an understanding that individual behavior is influenced by and influences the family unit. This systemic perspective allows for more comprehensive assessment and targeted interventions that can lead to more sustainable change. The ATA Code of Ethics emphasizes the importance of understanding the client within their environment, which inherently includes their family system. An incorrect approach that focuses solely on the individual client's internal psychological state without considering their relational context fails to fully utilize the principles of systems theory. This approach risks overlooking crucial systemic influences on the client's presenting issues and may lead to interventions that are less effective or even counterproductive within the family dynamic. Ethically, this could be seen as a failure to provide comprehensive care, as it neglects a significant factor impacting the client's well-being. Another incorrect approach that involves direct intervention with other family members without their explicit consent, or without a clear therapeutic rationale based on the client's treatment goals, would violate principles of client autonomy and confidentiality, as outlined in the ATA Code of Ethics. While systems theory acknowledges the interconnectedness of family members, direct intervention requires careful ethical consideration and appropriate boundaries. A third incorrect approach that dismisses the relevance of family dynamics due to the client's age or perceived independence overlooks the pervasive influence of family systems throughout the lifespan. Even adult children are often deeply embedded within family patterns, and ignoring this can lead to a superficial understanding of the client's challenges. This would represent a failure in competence by not applying the theoretical framework comprehensively. The professional decision-making process for similar situations should involve a thorough assessment that explicitly considers the client's family system. This includes identifying the client's role within the system, understanding communication patterns, and recognizing how systemic dynamics may be contributing to or maintaining the presenting problem. The BCDMT should then, based on this assessment and in consultation with the client, determine the most appropriate level of systemic engagement, whether through direct observation, indirect intervention, or psychoeducation about family dynamics. Adherence to the ATA Code of Ethics, particularly regarding competence, client welfare, and informed consent, should guide all decisions. Question 18. Benchmark analysis indicates that a board-certified dance/movement therapist is working with a client experiencing significant social anxiety. The therapist has been utilizing expressive movement techniques to help the client explore their embodied sense of self and their relationship to space and others. In evaluating the client's progress, which of the following approaches best reflects adherence to professional standards and ethical practice for BCDMTs? Option A. Measuring progress primarily through standardized physical fitness metrics or the number of social interactions the client has engaged in outside of therapy, disregarding the qualitative aspects of their expressive movement. Option B. Documenting specific, observable changes in the client's movement quality, such as increased fluidity, use of personal space, and expressive gestures, and correlating these observations with the client's self-reported feelings of confidence and ease in social interactions. Option C. Relying solely on the client's verbal report of feeling less anxious, without detailed observation of their movement patterns or how these patterns might have shifted. Option D. Focusing exclusively on the therapist's interpretation of the client's movement, without actively seeking or incorporating the client's subjective experience of their own movement and its impact. The correct answer is B. Documenting specific, observable changes in the client's movement quality, such as increased fluidity, use of personal space, and expressive gestures, and correlating these observations with the client's self-reported feelings of confidence and ease in social interactions. Explanation. This scenario presents a professional challenge due to the inherent subjectivity in assessing the efficacy of expressive movement techniques and the need to align practice with established ethical guidelines for board-certified dance/movement therapists, BCDMT. The therapist must navigate the balance between client-centered care, the qualitative nature of movement expression, and the professional responsibility to document and communicate progress in a meaningful and ethically sound manner, adhering to the standards set forth by the ATA, American Dance Therapy Association, and relevant state licensing boards. The correct approach represents best professional practice because it prioritizes a holistic, client-informed assessment that integrates observable behavioral changes with the client's subjective experience of their movement. This aligns with the ATA ethical principles emphasizing client autonomy, informed consent, and the therapist's responsibility to maintain accurate and objective records that reflect the therapeutic process. By focusing on specific, observable changes in movement quality, spatial awareness, and emotional expression, and correlating these with the client's self-report, the therapist provides a comprehensive and ethically defensible evaluation of progress. This approach respects the client's narrative while grounding it in therapeutic observation, ensuring that interventions are responsive to the client's evolving needs and that progress is documented in a way that is both meaningful and accountable. An incorrect approach that focuses solely on the client's subjective report without objective observation fails to meet the professional standard of documenting therapeutic progress. This could lead to a misinterpretation of the client's experience or an inability to identify subtle but significant shifts in their embodied state that the client may not be able to articulate fully. Ethically, this approach risks a lack of accountability and may not adequately inform future treatment planning. Another incorrect approach that relies exclusively on the therapist's interpretation of movement without incorporating the client's subjective experience neglects the fundamental principle of client-centered therapy. This can lead to an imposition of the therapist's own biases or theoretical framework, potentially misrepresenting the client's internal world and undermining the therapeutic alliance. From a regulatory standpoint, this approach may not meet the requirements for accurate and comprehensive client records, which should reflect the collaborative nature of the therapeutic process. A third incorrect approach that prioritizes standardized, quantitative measures of movement without considering the qualitative and expressive aspects of dance/movement therapy overlooks the core tenets of the profession. While quantitative data can be useful in some contexts, expressive movement therapy's strength lies in its ability to access and process emotions and experiences through embodied means. Focusing solely on quantifiable metrics risks reducing the complexity of human experience and the nuanced impact of movement therapy to a set of numbers, thereby failing to capture the full scope of therapeutic change. This approach is ethically problematic as it may not accurately reflect the client's overall well-being or the unique benefits derived from expressive movement. The professional decision-making process for similar situations should involve a continuous cycle of assessment, intervention, and evaluation, always grounded in ethical principles and professional standards. Therapists should actively seek to integrate client self-report with objective observation, utilizing a variety of assessment tools and techniques that are appropriate to the client's needs and the therapeutic goals. Maintaining clear, objective, and comprehensive documentation is paramount, ensuring that progress is tracked in a way that is both clinically meaningful and ethically sound. Regular consultation with supervisors or peers can also provide valuable support in navigating complex assessment and documentation challenges. Question 19. The assessment process reveals that a dance/movement therapist has been diligently attending to a client's progress. The therapist is now tasked with documenting the session. Which of the following approaches to documentation best reflects professional best practice and ethical guidelines for a board-certified dance/movement therapist? Option A. Documenting subjective interpretations of the client's internal state without referencing specific observable behaviors or movement qualities, focusing on the therapist's intuitive feelings about the client's progress. Option B. Documenting only the client's verbalizations and the therapist's planned interventions, omitting detailed observations of movement and emotional responses to save time. Option C. Documenting observable client movement patterns, emotional expressions, and the therapist's interventions, linking them to established therapeutic goals while maintaining objective language and respecting client confidentiality. Option D. Documenting a narrative of the session, including personal anecdotes about the client's life outside of therapy and the therapist's personal reflections on the client's character, to provide a comprehensive personal understanding. The correct answer is C. Documenting observable client movement patterns, emotional expressions, and the therapist's interventions, linking them to established therapeutic goals, while maintaining objective language and respecting client confidentiality. Explanation. The scenario presents a common challenge in dance/movement therapy documentation, balancing the need for comprehensive client records with the ethical imperative of client confidentiality and the practicalities of time management. Dance/movement therapists are bound by professional ethical codes, which typically emphasize accurate, timely, and objective record keeping. These records serve multiple purposes: facilitating continuity of care, supporting clinical decision-making, meeting legal and regulatory requirements, and providing a basis for research or program evaluation. The challenge lies in capturing the essence of the therapeutic process, including the client's movement responses, emotional expressions, and therapeutic progress, without including extraneous or overly subjective information that could compromise confidentiality or be misinterpreted. The correct approach involves documenting observations and interventions in a manner that is objective, specific, and directly related to the therapeutic goals. This includes noting observable behaviors, movement patterns, verbalizations, and the therapist's interventions and their perceived impact. Such documentation aligns with best practices by ensuring that client records are clinically relevant, defensible, and maintain the highest standards of confidentiality. It reflects a commitment to professional accountability and ethical practice, as mandated by professional organizations and potentially by healthcare regulations governing record keeping. Incorrect approaches fail to uphold these standards. For instance, documenting solely subjective interpretations without observable evidence can lead to biased records and potential misinterpretations, violating the principle of objectivity. Including overly personal or non-clinical details about the client or therapist compromises confidentiality and detracts from the professional purpose of the record. Conversely, omitting crucial details about the therapeutic process, interventions, and client responses leaves records incomplete and potentially hinders effective treatment planning or review, failing to meet the standard for comprehensive documentation. A failure to maintain accurate and objective records can also have legal and ethical ramifications, potentially violating professional standards and healthcare regulations. Professionals should approach documentation by first understanding the specific requirements of their practice setting and professional ethical guidelines. They should prioritize objective observation and intervention recording, linking these directly to therapeutic goals. Regular review of documentation practices and seeking supervision or peer consultation can help refine these skills and ensure compliance with best practices and ethical mandates. Question 20. Operational review demonstrates that a board-certified dance/movement therapist, BCDMT, is working with a group of older adults in a community center setting experiencing mild to moderate social isolation and decreased mobility. The BCDMT is considering various approaches to facilitate engagement and improve well-being. Which of the following approaches best aligns with the principles of ethical and effective dance/movement therapy practice in this context? Option A. Implementing a structured curriculum of traditional folk dances from a specific cultural region, assuming this will universally appeal to older adults and improve their mobility. Option B. Designing a series of movement experiences that encourage improvisation and shared creative expression, focusing on themes of connection and reminiscence, while regularly assessing group dynamics and individual participation to adapt the session's flow and content. Option C. Prioritizing the therapist's personal artistic vision for the group, incorporating complex choreography that showcases advanced movement techniques, regardless of the participant's current physical capabilities or interests. Option D. Focusing solely on repetitive, simple motor exercises without any thematic or expressive components, believing this is the safest and most direct way to address mobility concerns. The correct answer is B. Designing a series of movement experiences that encourage improvisation and shared creative expression, focusing on themes of connection and reminiscence, while regularly assessing group dynamics and individual participation to adapt the session's flow and content. Explanation. This scenario presents a professional challenge due to the inherent complexity of tailoring dance/movement therapy interventions to diverse client populations while adhering to ethical and professional standards. The BCDMT must balance the creative and expressive nature of the modality with the need for evidence-based practice and client safety. Careful judgment is required to ensure interventions are not only therapeutically effective, but also culturally sensitive and appropriate for the developmental and cognitive levels of the clients. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the client's needs, strengths, and limitations before designing and implementing interventions. This aligns with the ethical principles of beneficence and non-maleficence, ensuring that the therapy provided is beneficial and avoids harm. It also reflects the professional standard of individualized care, where treatment plans are tailored to the unique characteristics of each client. Adherence to the American Dance Therapy Association (ADTA) standards of practice and code of ethics is paramount, emphasizing the importance of informed consent, client confidentiality, and the use of evidence-informed techniques. An incorrect approach that relies solely on a single theoretical model, without considering the client's specific context, fails to meet the standard of individualized care. This could lead to ineffective or even detrimental interventions, violating the ethical principle of beneficence. Furthermore, it may disregard the client's cultural background or personal preferences, which is an ethical failure in respecting client autonomy and dignity. Another incorrect approach that focuses on the therapist's personal artistic preferences rather than the client's therapeutic goals represents a significant ethical lapse. This prioritizes the therapist's agenda over the client's well-being, violating the core tenets of the therapeutic relationship and the ADTA code of ethics regarding professional conduct and client welfare. It also demonstrates a lack of clinical judgment and an insufficient understanding of the purpose of dance/movement therapy as a clinical intervention. A third incorrect approach that neglects to document the therapeutic process and outcomes is a failure to adhere to professional record-keeping standards. Proper documentation is essential for continuity of care, accountability, and demonstrating the efficacy of interventions. The absence of such records can hinder collaboration with other healthcare professionals and impede professional development and research, which are indirectly supported by ethical practice guidelines. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive client assessment. Gather information about the client's history, presenting concerns, strengths, cultural background, and preferences. 2. Theoretical grounding and evidence-informed practice. Select theoretical frameworks and interventions that are supported by research and are appropriate for the client's needs. 3. Individualized treatment planning. Develop specific, measurable, achievable, relevant, and time-bound, SMART, goals and objectives for the therapy. 4. Ethical considerations. Ensure informed consent, maintain confidentiality, and prioritize client safety and well-being. 5. Ongoing evaluation and adaptation. Continuously monitor the client's progress and adjust the treatment plan as needed. 6. Professional documentation. Maintain accurate and thorough records of assessments, interventions, and progress.